questions. So if you see me looking down, that's what that's about. Okay.
Okay, I was going to say, I don't see the record button. That's
Yeah,
still fun.
it's up. It's up. You know what? I will give people a second to get on, but what I notice is when I record, when I first start these, these interviews I've been doing for a couple of years now, it's a lot of me doing this in the very beginning. So I try to hit the record button when I get my guest on, because it's usually just me looking confused for the first like 6
Same here. I stop the record.
Yep.
And then like if I'm sharing it on Facebook, I share it and I put back on the record.
Yep. Awesome.
Oh, somebody's listening from the gym. Yay!
Yay. Hey, Stan. Okay, so Stan, since I see you chatting, can you give me a sound check and tell me that you can hear us okay? And then we're going to do a proper introduction. We're going to get started about this topic that people have been asking me to cover. So I'm excited. Give me a thumbs up, Stan. Yep. Awesome. Thank you so much.
Hey, hi, Joan. How are you?
Hi, guys. Awesome. Okay. So I'm excited, you guys. So Dr. Veronica and I met at Mindshare a couple of years ago. She's an MD, medical intuitive, functional medicine practitioner, and homeopath. She's the author of the #1 best-selling book, which became the hot new release in holistic medicine, But Now I See, a medical intuitive surgeon's guide to the meaning of your illness and how to heal from chronic and incurable disease. She began her medical career as an eye surgeon and now has the distinction of being both a licensed physician and a practicing psychic. What a combination, power combination. Dr. Veronica is a best-selling author and speaker and has appeared in national TV. And in her program, she uses her gifts and talents to help people with complex health issues who feel like they just haven't gotten proper answers. Boy, do we know a lot of those. Or relief from the healthcare system. Her intuitive rejuvenation journey program guides people to wellness by not only working on the physical aspects of wellness holistically, but also unlocking and clearing the emotional, spiritual, and energetic triggers and root causes of disease. This just screams my topic right here, all of it. And I just welcome you so much, and thank you so much for spending time with us today, and hope that you're recovered from Mindshare. How long did it take you this year?
Oh, I don't know. See, I left early, but Carmen, I'm like so excited to be here with you because we've known each other and we kind of like clicked when we met, but we haven't had a chance to work together. So it's like, yay! I get to talk to Carmen today.
Yay! Yeah. So we shared some drinks and some dinner, and now we get to share some knowledge. So let's go ahead, and I want you to tell me how. First of all, let's start with the part that everyone's going to wonder: how did you go from being a surgeon to an intuitive? Like, give us a little bit about your story.
Well, first of all, you don't go necessarily from one to the other. You realize one day, or admit one day, because that's what happened to me, that you have this ability that's very, very, very developed. And that's kind of what happened. So I realized when I was working on, I had left medicine. I was an eye surgeon. I had my own practice. I started from 0 patients, got to double-digit thousand, very successful practice, other doctors working under me, but I was miserable. I was like, I couldn't stand it. I was in traditional medicine. I was seeing people go blind on dialysis and get amputations from lifestyle diseases. Mm-hmm. And on the other side, I was always living very holistically myself, and that's how I treated my family and everybody that I cared about. So I was incongruent, but those are the people that came to me, and I loved my patients. My patients loved me. They loved coming in and talking to me because they knew they were going to get a different perspective on life, but it wasn't where I needed to be. So one day I just walked out of my own practice that I owned. I walked away. I quit my job, which I was employed by myself. And I left my church because I was like, no more of this crap. And I left my marriage. Now, in defense of my leaving my marriage, my ex-husband is not a bad guy. What happened for me, because some people might find this, is that I just knew I was supposed to be doing something else, somewhere else, with someone else. And I couldn't put my finger on it until I actually cut the cord and left. And I didn't know that. But when I did cut the cord from all that stuff and leave, I fell into a severe depression. I was clinically depressed. I was going to the psychologist twice a week, and it was hard for me to get from visit to visit. And I know somebody's out there saying, oh, I know what you feel. I was surprised when the sun came up. That's how depressed I felt. I'd be on the floor feeling like, wow, the sun really came up? How did that happen? Because I felt so bad.
Yeah. But how does the world go around? How does the world go on when we feel so bad?
I understand. When people say you don't understand, I mean, I understand because I've been there, done that. I had what most people would consider a beautiful life. guy I was married to is my college sweetheart. We had built up our lives and our businesses together. We were financially successful. I had my own practice. He was doing his own thing. I got my 3 kids going on. Everything looked like the American dream, except I was not happy because I knew I felt ashamed. I felt ashamed that I felt that way. And so that's why it took me so long to just like jump.
Right.
And when I did jump, I hit the ground hard. Sometimes when you jump, they say, "Oh, you'll just be caught." No, I hit that ground really hard. It was very painful.
Yes.
But in the meantime, let's fast forward in life. I ended up meeting a man at a party one night of a friend. Didn't know that he was the one, wouldn't even look at him or talk to him at the party. He said something to me at the dinner table, and he was on my right side, and I said, "Thank you very much," and I didn't even turn and look at him. Well, I ended up married to that man that I wouldn't turn and look at. And a psychic predicted I was going to get married before I met him. 3 months before I met him, a psychic told me I was going to get married the year after that. And I was like, who am I going to marry? Who? What are these brokers I'm dating? So in doing that, we ended up starting an international import-export business. And I was the face of the marketing. So I wasn't doing anything in medicine. So I had a podcast and I was doing that kind of stuff. But I was like kind of taking a breather and a break. What happened is people started realizing around the world, you're a doctor. They would text me, WhatsApp, Viber, Skype, regular text. You're a doctor. Can I ask you a question? And as soon as they would say that to me, I knew what was wrong with them. They didn't have to tell me anything else. It would pop in, malignant hypertension. They need to do this, that, and I'm like that for me. That's how it would pop in. And then, but my business coach said to me, "Wow, you're a medical intuitive." I said, "A what?" "Well, here's what it is." And I was like, "No, doctors don't do things like that." No.
Right. Yeah.
And I wouldn't talk about it. I wouldn't talk about it because I was like, that's no. And I realized now I wouldn't talk about it because I was afraid of my colleagues. I was afraid of other practitioners, especially other MDs and DOs, saying that I was a quack. And there's still some people say I'm a quack now. Not my clients who get results, of course, but other practitioners who are not getting results.
Yeah.
In the traditional way of doing things want to call me a quack. And I'm like, listen, my proof is in the clients that are well, and I don't care what you say. But it took me a while to get there. It really did. In fact, I had a really huge knee injury in early 2013 that, my spiritual counselor at that time said, you had this because you have these intuitive gifts and you're not using them. And this is why your refusal, your inflexibility, and that you have these gifts, you're not using them. And this is why you had, I tore everything and detached my tendon. That's how bad this knee injury was. So I had a full stop right there in life because, we were laying up and you can't hardly do anything because you can't get around very well. But what I started to realize as I evaluated, there's a couple things that would have to be. Number one, I was having spontaneous past life memories. I could meet someone and it would flash in this whole scenario. I'm clairvoyant. I'd see things like pictures. And I know a story about them, very detailed. You ask me anything, I tell you anything about the story. That's how you know a past life memory. And on the other side, I started realizing from a health perspective that even when I was back in medical school, and yes, I graduated with honors and I did well on all the tests, but that doesn't mean you're a great clinician. And I was the type of person, as a medical student, they could put a case in front of me and I would know what it was. To the point where the professor wouldn't call on me anymore because he knew I would know the answer. And I realize now that, yes, I had studied, but knowing how to put it all together is a really different skill. And I realize also now that brilliant practitioners, that's what they're doing. They're tapping into intuition. But I still didn't want to talk about it.
I get it.
When I did start talking about it, a lot of people said to me, how come there are not more doctors like you? How can you help me? What do you see? I have this. And so then I said, okay, I'm going to offer this as a service. And it is now my most popular service. When people come to me, they come to me because They feel everything else has failed, and I want them to feel everything else has failed. I want you to try everything else to get well. I want you to fail your PhD at WebMD. I want you to fail at the medical school of Facebook. I want you to fail at all your doctors with all the beautiful degrees on the wall, and then come to me. And why do I do that? Because then you're open. If you're suffering, you're open to hearing a different answer. And what happens when I say, I channel people's energy. Your energy gives me a message. I'm going to tell you back what your energy is saying. That's what I'm doing. So I don't even call myself a healer because people's bodies know how to heal. You know this, Carmen.
Yeah.
We don't heal anybody. People's bodies know how to heal. Even when I can help move energy, I can help move energy so your body remembers to do what it already knew how to do and forgot.
Yeah.
And so if I help cut a cord or move some energy or say, oh, let me do this, it's moving or helping put something back together so the body says, oh, I remember now, I can get better. That's how people have these miraculous healings. They get energetic healing first. So it's been a wonderful journey. I've gotten to the point where now I'm training other practitioners because they came to me and said, how do you do what you do? And because, I'm academic by nature, I'm we didn't talk about that. I got an Ivy League degree behind me. I graduated with I'm academic. I have a system, a protocol, and I can teach it and I can so intuition, everybody has. We've just been taught to ignore it on most cases. And I want to say to the audience, never, ever ignore your intuition. Never ignore it. It is your GPS, it's your guidance system to keep you safe. And so even if you go to a practitioner and they tell you something and it doesn't ring true with you, it's probably not, because all bodies aren't the same. It really is. And so I'm here. When you can't get an answer, I got other answers. That's why, I got the training in functional medicine. I got the training in homeopathy. I keep going and getting more esoteric background and training so that when people come to me, when I download what's going on in you, I'm going to get all these really interesting, complex answers. That's why I tell people, hey, you might go to a medical intuitive and they don't really have any medical background. That's all well and good, but they're not going to get deep in why and say, you know what, you're sensitive to cantaloupe. You know what I'm saying? I mean, they may not get there. Okay, now that we know you're sensitive to cantaloupe, I don't want you to go read that book, because here's the protocol that's going to work for you, because this is what your body is demanding. And then not only can I do that, I can then say, okay, now let me switch over to my left brain and go over to what the protocol is. And let me say, you know what, this is not my core genius. Let me pull in the Carmens of the world because they're better at this particular thing. Hey, you know what, because I'm intuitive, I can come up with, here are the practitioners that you should see. I have people, you know what, don't go get 25 tests. Here are the couple tests that I think would hit it on the head based on what your energy is telling me. So don't get those 25 tests. Here's the test you need to good, i.e. go get your fatty acids tested.
Right.
Did I tell you that?
So let me interrupt you for a minute. Yes. Yeah, that's what you told me when I reached out for the pinguecula. Okay, so let's back up for a second, because I want to get specific, because, I want to talk more about the eyes. Let's go straight to the eyes, because we're going back to the fact that you're an eye surgeon, and which it just still blows my mind that here you are doing surgery on people's eyes and like completely immersed and immersed in conventional medicine. And now here you are on the other side of that, completely blowing things up with the other side of what you do. Tell me about, what is it about the eyes? Like, what is it that is a spiritual link, an emotional problem? How can you see that in someone's eyes? Or how can you find that in the disease, the eye disease? Like,
so first I'm going to tell you that before I was admitting what I could do and realize what was going on in my life in this area, because, sometimes you're in a world and other people around you are not in this world. And so you don't have anybody to answer the questions. So the psychic that I went to was a psychic of my best friend, told me, oh yeah, you're an eye surgeon. You're an eye surgeon because there was one of your past lives that you were blinded. And so you became an eye surgeon to fix that now. So that's, a piece. And I could not, now I can see that life and what happened and tell the story around it. I was actually in a very fundamentalist religious society. I was working in a healing profession, very talented. I've been through many, in fact, she already also told me I've been through many lifetimes working in the healing arts. It's part of my innate, my DNA, my soul journey, my everything. And so that's the eyes. But on the other side, as far whenever you have an eye problem, now there's different parts of the eyes. You have to wonder, so first of all, what is it that you are refusing to see or you don't want to see? I mean, it's easy to think of these type of things.
Of course.
Okay. And so I was actually a fellowship trained glaucoma specialist. Glaucoma has to do with pressure in the eye. And so on the other side, but there's also what's called normal pressure glaucoma too. But this is something where you're not draining fluids in your eye. And so think about not just what you're seeing, what's not going on, fluid in your eye, if the pressure is actually high, what's stressing you that you don't want to see, that you're looking right at. And so because you're looking right at it, you're going blind. This is what happens to people with glaucoma. For no reason at all, their pressure goes up and they start to lose their vision. Okay. Now, it was, oh my God, and we used to call it like the cancer of the eye. I felt like I have to keep them seeing before long enough so that they live out and they don't go blind before they die. It was very difficult. It was challenging. I was doing difficult surgeries with it that were very stressful, because everybody wants to see. I think it's such a quality of life type thing. But there are some people who don't want to see. In fact, I had a gentleman that his life, he was depressed. And he was so depressed with his life that after I did surgery on him and all of a sudden he could see it and it was really clear, he went blind again. So I restored his vision and he lost it again. And this is something that people, if you don't deal with whatever spiritual issue is going on, it's going to continue to go on. So I'm going to bring it to another part of the body. Let's talk about women, and we're coming up on breast cancer. So whenever you have a cancer, and I have an oncologist colleague who we talked about this on the interview. People who have cancer had a death wish for some reason at some time. And if you don't confront that death wish right on. Now this is, people will say, is that blaming the victim? No, this is giving you hope, realizing that you have more control than you think that you have.
Right.
And by changing your mindset, it changes your physiology. This is the biology of belief with Bruce Lipton.
Oh, yes.
Now, on the other side of it, it's not so easy to change or know exactly what the issue is. And that's where people like me come in, because I can pinpoint and say, here's what's going on. Here's what your body's saying. It's not what you think it is. It's not what you're verbalizing to me. That ain't the issue. Here's what it is. And your body will not let you hide from you.
No, trust me.
If you have breast cancer and you don't deal with whatever it is and you get treatment, they say you're cancer free because they cut your breasts off and you can't have cancer there anymore. You're going to have a lung problem, still in the lung chakra. Yes. You're going to have a chemo. You're going to get heart failure from the chemotherapy. Yeah, it's listed. You're going to get lymphedema. Nobody even hardly gets lymphedema anymore. But guess what? You got it.
Yeah.
And I met a woman like this, actually a doctor, who admits, I got every complication because I was having a major issue and I refused to deal with that major issue. And that's how the body speaks to you. Your situation will get more and more and more and more intense until you deal with it.
Okay.
And the answer is the death wish. The question is, why did you have that? Let's unravel that. And then we want to take that, the fear, the anger, the sadness, that is health harming, and move it over to the gratitude, love, and joy. And this is how you have to work on your health. 360. You can't just eat the right foods. You must. You have to support your body. You have to support the body. But you got to deal with those energetic and emotional pieces so that your body will fall in line and it will stick.
Yeah. Yeah. So let me just throw this in. So, you knew last year before I opened the school, I had 5 foundations for all human beings to find health. And that's what I teach my students and my members. I added the 2, spirituality and trauma. Before we opened the school up, we added 2 more, and it was spirituality and trauma, because I've been studying this for many, many years. And I truly agree with you 100% that the body speaks the mind. And the intuition is a huge part of how we coach our clients. it has to be, we have to teach them how to tap into their intuition. And I always say, no doctor, no coach, no one can tell you what's going on inside of you but you. So the best way for us to help our clients is to tap into that intuition, right? Yeah. To be able to understand that, like you said, it's a GPS, it's a message inside of us, but we shut it off with supplements, we shut it off with exercise, alcohol, other people's opinions of us. We shut down all of our instincts and intuition with the outside world. And don't you think that's just one of the biggest problems we have today? We're not even listening to our own messenger inside of us. We're listening to the world around us.
Yeah, but we've been taught not to. So
exactly.
We've just been socialized that something outside of us is the answer.
Yeah.
And the answer really is within. Whenever I ask people, so if I do a reading and I ask people, here's what I think the issue is, what do you think? They're like already shaking their head before I can get the words out.
Totally, yes.
But or if I say, well, why don't you tell me what you think the biggest issue is? There's never any hesitation. They know what it is.
They do every time.
There's a process to unpacking it.
Yes.
And that process does not necessarily happen on the psychologist or psychiatrist's couch. Now, I'm not saying don't go. There's a role for it. And there may be a role. Like when I was going through my depression, I don't know what I would have done without my psychologist. I don't know. Okay. Yeah. But I also had a psychologist who also was a theologian and taught at a seminary. So sometimes she would give me very spiritual answers. Like she said, don't be so quick to get over your depression. And she gave me a book about dark nights of the soul.
Yes, I love that. Was it Thomas More?
Thomas More, yes.
Yes.
Right,
yes.
So I'm reading and I'm feeling like crap, but I'm reading and taking it in and realizing that it is truth. And in my soul, I knew it was truth. But I also, on the other side, knew I was going to get through it. I didn't know. I feel like I went through it. It's part of so I could tell the story of getting through it. And I was able to get through it without using pharmaceuticals, even though my psychologist thought I was so depressed that I should consider it. Yeah. And I said, no, I'm not doing this. And my personal trainer, Dave Goldberg, oh my God, I go and train with him and I'd be crying. I'd be, man, I'd walk in and I'd be like, over, I don't even, you know how it is when you're depressed. It's just anything and everything is sad. Yeah. Because that's your inner melancholy coming out. But I needed to go through that and get it out. Yes. Part was I was mourning the death of a previous life, the life I was living. I was making a major change. I mean, because everything's so totally different. My friends are different. My husband's different. My spiritual beliefs are now in sync because, when I was going to a Christian church and I taught Sunday school and everything, but I was the questioner. I was the rebellious one. And my ex-husband used to say, why are you being like Jezebel? All right. He used to say, I'm like, because God gave me a mind and I'm supposed to ask questions. So don't tell me because God said so, that ain't an answer. Right. And my name is Veronica. My parents were Catholic. And, I'm just like, I'm Catholic, so I'm going to call out the Catholic Church. All right. Why y'all, so I believe that you take your journey and path. It's all so that you're going to evolve. Yeah. So I had to take that journey. And your illnesses and injuries are the messages from the universe so that you go to a higher level. Right. If you stay in the sickness, you're not going to necessarily move up. Right. Now, let me just talk about one other piece about that. Sometimes people are sick because they need to give a message to somebody else. They need to teach somebody else. So it might be that, my father with diabetes, high blood pressure, thyroid disease, depression, all this other stuff. I watched him all my life. And so I live my life differently, but I can see, things that I thought were my issue or not my issue. They're his issues. I mean, in fact, here's the other way that, people who work in the energy field, 2 weeks ago, I was working with an energy practitioner on me because, practitioners, we got to work on ourselves too. Yeah. So anybody who out there, don't think once you've got the education and training, it stops. Mm-hmm. And so I reach out to a lot of practitioners. If they say, I don't need any more learning, I'm like, cut the cord on them because they don't understand they need to evolve. So I'm working with this practitioner and she's uncovering issues that I picked up from my father as a child that I didn't even know were there. Mm-hmm. she said, what happened at age so-and-so?
Yeah.
And I'll say, this happened at age so-and-so. Now, it wasn't something, I wasn't abused, or it wasn't that type of story. You don't have to have those intense type of stories to still experience trauma in your spirit.
Right.
And that's something that needed to be cleared. When my father was stressed and he was unemployed and he was becoming depressed, I picked that up as a child. It was still in my energy. Yeah. And in order to make me more vibrant, more whole, more able to move to the next level, working with different types of people, I needed to have that cleared. But I didn't even know what it was.
It's like ancestral DNA. It's like ancestral trauma that gets trapped in your DNA, and then you carry it and carry it and carry it until you don't carry it, until somebody breaks that process up and gets rid of it so that it doesn't have to continue.
Yes, that's right. And so part of when I wrote my book, part of the idea was that I'm not giving you a recipe for how to do it. There's a lot of books on here's the diet, here's the this. Nope. This is conceptual of that. I want you to start thinking that these could be the problems. Start looking at them. So the first chapter is called, Is Your Church Killing You? Mm-hmm. Because a lot of people follow religions on fear, anger, and sadness. The religion is speaking fear, anger, and sadness, and you're buying this fear, anger, and sadness and reacting in it because you want to belong, because you're scared of not belonging. So anything related to fear, anger, and sadness, even if it's religious and you think it's related to God, no, God doesn't want you to be in fear. God is love. Everybody says that, knows it. And if anybody's teaching you anything that says anything other than God is love and he accepts everybody, they're teaching based on fear, anger, and sadness, and your religion could be killing you. Right. My next question is your doctor making you sick? Yeah. Because guess what? When we went to medical school, we were taught how to prescribe drugs. We were never taught how to get people off of drugs. We were taught to ignore the side effects of drugs. Now, here's what I'm going to say. Forgive your doctors, because when you go in there, you are in crisis. And they got to get you out of crisis so that you can get to the next step, which is something holistic. Unless you have the strength to do it on your own, and there's not a lot of people who necessarily have the strength. Right. Now, I've met people who've had cancer and gotten over it, but they had the knowledge and the wherewithal to know what they had to do and have the discipline to stick to it, but also the energetic tools to be able to stick to it too.
Yeah. So, let me say this. I want to just interject because I want to lead into a couple of questions that I know that people are curious about. But let me just, with a real quick personal story, you know a little bit about me and about what I went through last year. And I had thyroid problems. My adrenals were crapping out. I had H. pylori, leaky gut, UTIs, you name it. But interestingly enough, let me say this. I was on a journey for many years to try to figure out what was wrong with me, why I had chronic pain, why my thyroid wasn't working. And one time my husband asked me, maybe it's me that's making you sick. This is about 9 or 10 years ago, right? Well, guess what? When he left for the final time, my thyroid numbers came back normal. I lost 10 pounds. My life completely changed. I didn't sink into a depression. I pretty much I took it by the horns and I ran with it. But like you said, we have to have this dark night. It's almost like we have to fall completely apart or have that heart attack in our lives so we can wash all the old away so the new can come. So with that particular little bit of my story, I want to ask some questions about the thyroid, about the eyes, about autoimmunity, because those people had sent those to us. I want to make sure we don't miss this. So tell me about the common conditions that do affect the thyroid and autoimmunity and inflammation, and especially the dry eye syndrome. I'm really interested in that too, because I have about 4 people at the gym that are always putting stuff in their eyes.
So here's the first thing. First, let's talk about dry eye. When people come with something physical, the first thing you have to do also is look at, well, is there a physical issue? Mm-hmm. And so one of the things, and this is not talked about in traditional ophthalmology at all, not in my teaching, it's not in the textbooks that are on my bookshelves. And I'm like, I need to go to the American Academy of Ophthalmology and start teaching about this, is a lot of times people have low fatty acids. They do. And so therefore, your tears have oils in them. If you don't have enough oil in your body, your tears aren't going to stay on your eyes. That's number one. The second part about dry eyes is a lot of times it's related to inflammation. hint, autoimmunity, in your glands that are making the tears. If the inflammation is in the gland, you're not going to make the right type of tears because all the apparatus won't work. So you have to think of it, I'm talking about it from a physical standpoint where one of the drops, I'm trying to remember the name of it, I used to use so much. It was a steroid. It was a mild steroid for dry eye. And it was so effective because I was treating the inflammation, suppressing it though, not treating the underlying. Okay. So fatty acids are really important. And when I'm talking fatty acids, I'm talking fish oil. And I would say for the eyes, this is my own concoction. I'm telling you, you're not going to read this in a book, that you need to have higher DHA than EPA. Why is that? Because the eyes are part of the brain. Your brain is mostly made up of lipids and fats. And so you boost your DHA over EPA, and at high levels, it's going to help the dry eyes. And it's anti-inflammatory too. So popping fish oil. Now let me just talk about dosages. When we talk about dosages to treat everything, it's a lot more than what you see on the bottle. Yeah. So there's two parts about it. Number one, you want to make sure it's not something contaminated. And I'm not going to hawk a particular brand. I mean, as a practitioner, I have multiple accounts with nutraceuticals that are high grade, and we can test them. Okay. So we know that they're good. How do you know a supplement is good? You want to see it has like a GMP. You might teach about this. There's certain labels on the bottle that let you know it's a high quality supplement. So number one, look at that. One of the ones that you can get in the stores very easily is Nordic Naturals. Mm-hmm. They have a very good supplement line. The other one that I really like for EPA, DHA, or any type of fish oils is Vital Choice. They're high quality. We actually know him from Mindshare. I met him another time. He's a charming guy. The guy who's the owner of Vital Choice. Yeah. He's just, you meet these people and you know their product's good because they're so good and their energy is so good. You're like, he can feed me anything because this is a wonderful man, right? But I look around I want you to be able to get it easily. It's great to partner with a practitioner because then they can help you with a dosage. But usually you need like at least 4 to 5 grams. So a gram is 1,000 milligrams a day to usually get enough, maybe even higher than that. So me personally, I take a fish oil, which is higher in DHA, along with vitamin D3. Yeah. And I also take a D3 along with a K2. Yeah. All right. So now there's a lot of, this becomes challenging to figure out, which is why you need somebody who has some background education and training that's real to be able to figure out what the dosing is, because dosing for these is different based on your condition. So when you go to the pharmacy and you get some fish oil, and you just take what's on the bottle, chances are you may not be taking what is the right dose for your particular condition. And I just told you about a dose for one particular thing. If you have cardiovascular disease, it's different. If you have osteoporosis, it's different. But dry eyes, first thing I want to do is I want you to boost your fish oil. And then let's see where you are. Now, you see all those people at the gym. Why are people having all these dry eyes? Inflammation. And where's inflammation coming from? There's so many bad things that are going on in people's bodies. Even when you work really hard to be healthy, you are exposed. Yeah. They're showing babies and mothers who are eating well come out with a bunch of toxins in them. Yeah. Breast milk is now more toxic than formula. And so we're pushing people to breastfeed. Yeah, that's all well and good. You test breast milk, it has toxins in it. And so you're feeding your baby toxins. Okay. Yeah. So now wait, I just got to answer one thing in the chat. Oh. All right. So Stan, I'm not knocking all religion. All right. I just want to say, Stan, I'm not knocking all religions, but many of the religions that you go to are teaching fear, anger, sadness. They are. Anything that, to me, this is my opinion, teaches separateness, teaches that those people are bad and we're good. We're going if we say and do this, but you're not going because you don't say and do this. Right. That's based on fear. Right. And you feel like if I don't do it this way, I'm not going to be loved and I'm going to burn in hell forever. That's fear, right? So if you're doing it based on I love it, I love all people are wonderful. I mean, this is, you know, I look at people based on not what they label themselves. This is why I left my last life. Because people liked me because I went to a particular church and I called myself a Christian. All those people who liked me because I called that, as soon as I stepped out of it, they weren't loving on me anymore.
Right. Yeah. So we don't want to spend too much time on the church thing.
Yeah, I don't want to spend, but he just said, why are you, I'm not picking, if you're a Christian, absolutely, if it's working for you, it's fine. Just remember to do everything you do in love, not fear, because the opposite of love is fear. Absolutely.
100%. There's a book out there called Love is Letting Go of Fear. Highly recommended. It's based on the Course in Miracles. Okay. So talk to me a little bit about what since I'm, you know, prime picking here, postmenopausal, what kind of things can I expect in my eyes when my hormones have changed so drastically? Right now, I don't have any problems. So I'm knocking on everything besides the pinguecula that I messaged you about. But tell me what can be expected when hormones start to shift with sight or with vision, or, I mean, with, you know, what can we expect?
Oh my gosh. Okay. So as the body matures, different things happen as you go through different parts of your life. So the way you are at 20, you know, there's a lot of sick 20-year-olds. Let's say you're healthy at 20. It's not going to be the same at 50, 60, 70, even necessarily 40.
Of course not.
And so when your hormones change, everything about your physiology changes. And that's a sign that you have to reevaluate and change along with it. So what a lot of people do is they fight it. And you know, based on the law of attraction, you fight. What you resist persists.
Of course.
You can figure out, how do I flow with this? I have a great product for women. This is, you know, she's a Mindshare member too. Dr. Annika Becca has actually 2 great products.
I think I'm actually interviewing her. I think I'm interviewing her.
Interview her. Tell her I told her. Julva. Julva is for the vagina.
Yeah.
And it has in it DHA. It has in it some other things. So I got to go look at the bottle.
That's okay. I've already got her scheduled, so we're good. Yeah.
Good. But what I'm saying is, you have to realize that your hormones are going to decrease normally with life, and sometimes you're going to need some help. That doesn't mean you need bioidentical hormone replacement therapy, but that may be the right answer for you. There are other things, like she has another one, it's called Mighty Maca. Maca is also something that's very good at different phases to help you be vital. Right. It's used for fertility. It's used just to keep you healthy. It's used for men. It's also used in women who are perimenopausal or menopausal. And so as your body's changing, your hormones are changing, and it changes the physiology of everything. And this is we could go into a lot of biochemistry and physiology about this.
No, I just want to talk about the eyes. Let me talk about the eyes and hormones. I want to know about those. That's where I'm going with it, because someone in perimenopause was struggling with her vision. And it was one of the private messages I got. She said, please ask what happens when your hormones change to your vision.
Okay, so let me talk a little bit about, you have to understand all your hormones are connected.
Right.
The adrenals become before the thyroid comes before the sex hormones.
Right.
And so generally, as you are aging, your adrenals are acting differently, your thyroid's acting differently. And so the biggie with eyes tends to be the thyroid. And you get thyroid, people a lot of times as they old, their thyroid doesn't work as well as it did when they were young. And that also relates to dry eyes.
Right.
So you may not have frank thyroid disease, but it may help you to take some supplements that boost your thyroid. So realize that if any of the hormones are changing, all the other ones are changing too.
Right.
So as you're aging and your testosterone, your estrogen, and progesterone are changing, they're way downstream.
Yeah.
Your adrenals have changed, your thyroid has changed, and all of it goes downstream to the sex hormones. So when you're thinking like, oh my God, everything's changing, most people say, I'm falling apart. No, you're not falling apart. These are normal transitions. And unfortunately, in the American culture and society, we don't have, as passed down from mother to or father to child, what to do about these things holistically and naturally. On the other side, your body's going to be more stressed from eating things like sugar or anything that turns on to sugar. You just can't handle it as well because your stress hormone, your cortisol, and your adrenals can't handle it as well. So therefore, you're going to have to change the way you're eating just based on that. And you know about adrenals and everything like that.
Right.
So these all, and the big, like I said, the big offender with the eyes a lot of time is thyroid.
Right.
And you can, I can have people walk in my office and I'm like, okay, you have Graves' disease. Okay, you have this. You know, people are like, how do you know I have a thyroid problem? I'm like, I can look at your eyes and tell you have all the signs of a thyroid problem. It manifests in the eyes. So
Right.
that's a biggie. So if you're having any eye problems, you have to evaluate your thyroid. Now, on the other side of that, realize that when you're going to lab testing, there's a lab reference range.
Oh, we already covered all that. Yeah.
Right. So do make sure that if you go and you know they say you're in range, you may not be in optimal range.
Yeah.
And even if you think you're in optimal range, that may not be the optimal range for you as an individual. So therefore, you still need some tweaking. And this is where some of the natural supplements can come in, like even like glandulars and things like that, which are controversial. I admit they're controversial, but they work for some people.
Right. Yeah. So you know, we're talking to health coaches, which they have a lot of education on this stuff for sure. They know a lot about the endocrine system and adrenals and all of that good stuff. But you know, one of the things that's kind of, actually, let's stay at the Graves for a second, because you know, I wrote a 52-page book on the thyroid. And one of the questions that I get a lot of times is, why do people's eyes bug out with Graves? Is it the pressure behind the eyes? Like because I can see a Graves person a mile away as well.
Yes, and it's an autoimmune disease, and what happens is there's antibodies in the muscles, and that's when it's really, really, really gotten bad. The muscles have gotten so big and fat from the antibodies that it pushes the eyes out forward, and so that's what's actually happening. So if you do a MRI, you will see gigantic muscles on that person. Sometimes people have to have decompressions in their brain to deal with that. Now, if knowing what I know now, I would not send somebody to the neurosurgeon anymore. I would put them on it's an autoimmune disease.
Right. Yeah.
That's whether you have Hashimoto's or you have Graves, they're really both the same thing.
Yeah.
They're both an autoimmune disease, and your body will decide based on what your underlying energetic and spiritual system says if you're going to go high or low.
Right.
And people who go high and hyper tend to be that's the Graves.
Right. And then they burn out and turn hypo. Yeah.
They burn out, they get treatment, they get a radiation, all this other type of stuff. And it's really about, you have to control the autoimmune disease. And if you have Graves' disease or Hashimoto's and you have it in your thyroid, you have it across your whole body.
Right.
It's manifesting in your thyroid because what's going on? You're having some problems with communication, your voice, and all that other kind of stuff.
Oh, yes.
What else you say? Okay.
I know that. I know that story.
And you know, it's really interesting how you said your husband said, well, maybe it's me making you sick. And what happened? Now, he said, it's me making you sick, but you were choosing to allow that to happen, and for a long time choosing to stay in a relationship for whatever reason. And we all do this. This is not.
Of course. It was all about not being able to speak what I believe to be true for me, and that's where the thyroid problem came from. And yes, I mean, we're not going to talk about my relationship. Let's move on. It is way too much complication.
I remember we were sitting at the dinner table and you were saying a few things. But you know, like, here's the thing. It's nice to get to the point where that person who gave you that intense experience, which may right now be anger, because I can tell you coming out of the door angry, to be able to get to the point where you can really truly forgive them and then be grateful for the experience. So what helps you with health? It's gratitude, love, and joy.
Yeah.
And can you realize that person that gave you a really intense experience in the soul world, you agreed both to play that role because this was part of your learning. Now, when you're going through it, when you're walking through the fire, you're just pissed and you can't think spiritual at all. But then when you get past it, you're just like, you know what? And like, so even for me, I don't know, about a year ago, I could see my ex in one of my past life memories and be able to tell you the role that he played, knowing that we've traveled in this. So people who are giving you these intense experiences that you might call bad are generally the people who love you the most on a soul level.
Right.
They have agreed to play that. You agree to allow them to play that role, and they agree to allow you to play a role. He's pissed at you. He's learned something from whatever you did. And it's not about assigning who's right and wrong, even if it's something that even the law says is wrong. It's about having that experience so you can evolve spiritually.
Right.
This is how we evolve spiritually.
Right. Okay. So we're going to switch completely off spiritual for a minute. Like, I don't want to miss questions.
Okay. Go ahead.
All right. Eyes exposed to the sun. We're going to talk about eyes because you're the eye doctor, but eyes exposed to the sun. Do you believe, let's start with how I start my day. Every morning when I get out of bed, I open my blinds and let the sun hit my eyes so my cortisol will go up. Do you think that's a good practice?
I think that I don't think you have to open the shades for it to happen, just a normal lightning. Now, if you got blackouts, that could be a little bit different.
Right.
Do you have blackouts?
No, I don't, but I have plantation blinds and it's really dark in my house. But just exposing your eyes to the sun or to the light, itself will take that melatonin down and raise the cortisol up and start the day. Is that correct?
Yes, but here's the other thing that happens. Before you even wake up, what makes you wake up is your cortisol goes up. So your cortisol has basically started to go up, and what made you wake up is the going up of the cortisol.
Right.
You do not have to be able to do it. Now, here's the thing. Once your body's in a rhythm, it's going to do it anyway. It's like me. I wake up 5 o'clock in the morning, probably before my clock rings, all of the time, because that's the set point of my body.
Me too.
Now, when you get sick and your adrenals don't work correctly because of all the stress that's come in, that's when you stop reacting that way. And that's when you start getting in trouble, and you're having that crash in the afternoon and eating the carbs, and you can't get out of bed and you're tired. This is what's happening. So you don't have to.
But it's beneficial if you're struggling with adrenals to try to get your circadian rhythm back on track by exposing eyes to sun.
Yeah, and something that's really, really hard to do, like exercise in the morning, will also help you raise it up too.
Yeah. Okay. So do you think we should be wearing sunglasses?
It depends on the color of your eyes.
Okay. Tell me why. What is that? Because I hear both sides.
Okay. So people with darker eyes have more protection from the sun. People with lighter eyes have less protection from the sun. If your iris is like blue or gray, there's going to be more that's coming in. The UV rays are going to come in more, and then you can have more types of eye diseases, such as earlier cataract formation. For people with darker eyes, they have more protection. Okay. And so therefore, sunglasses aren't as important. They tend to be, it's comfortable, it's cute. But for people with light eyes, I'd recommend, those are the people, you got to wear the sunblock, you need to wear the hat, get out of sunbathing, just be happy that you're pale as you are and call it beautiful. You know what I'm saying? So sunglasses, dark-skinned people, dark-eyed people, less mandatory. Light-eyed people, wear them as much as you can, all the time, including in the winter, because the rays coming off things like snow, and even if you go out and it's not sunny out, the rays are still coming in. So even if it's cloudy or it's winter or whatever, wear the sunglasses. Okay.
All right. So where do floaters come from, and why do they increase as we age?
Okay, so floaters, this is the fun stuff. Floaters are the big pain of the eye doctor, because everybody gets them and they're so annoying, and there's no safe treatment to get rid of them per se. So inside your eye, there's gel, and that gel is called the vitreous humor. Why do they call it the vitreous humor? Because they used to think it was the seat of your humor. And that's how it got the name, vitreous humor. So the vitreous is a gel, which also has a collagen fibrils, and it's usually attached to your eye. And so as you get older, it unattaches. And when it unattaches, all of a sudden you can see the collagen fibers in there. It's casting a shadow onto the back of your eye, your retina, which is like the film in a camera. And so it's not generally dangerous, unless it's associated with a big shower or you're seeing flashes of lights. And they don't go away. They stay in your eyes, but what happens is your brain begins to ignore them. So you may see a floater for a while, you'll say, my floater's gone. And why can't the eye doctor do anything about it? The only thing you could do about it is to do a removal of the vitreous, called a vitrectomy, and that's an invasive eye procedure. So no eye doctor who's ethical, in their right mind, would subject somebody to an eye surgery, which could cause loss of vision or loss of the eye. from
Right.
getting an infection for something that's an annoyance. And I call it a minor annoyance. It may be major to you, but it'd be more major if you lost your eye from a surgery that was just to get rid of something that your brain will ignore.
Okay. Makes sense. Interesting. Gross, but interesting. Okay. Floating cartilage. Okay. So what are styes from? Okay. First of all, let me say this. What's a stye? Why do we get them? And how do we treat them?
Okay, so a stye is when the glands around your eyes, you have a lot of glands. Now I talked about the tear glands where they're secreting fluid. The glands around your eyes become clogged and actually form what's called like a granuloma, which is like inflammatory material there. So sometimes your eyes there's some people who are more susceptible. People have a condition called blepharitis, which is when you get dandruff on your eyes. This tends to happen more in light-eyed people and blonde people. But you can just get all of a sudden a blockage there from just every day these things happen. And it grows open into like a little, what's called a granuloma. And that's what a stye is. Okay. Now, when it comes early, the best thing to do, and you've all heard this, everybody knows what to do for it, is warm compresses. One of the best ways to do a warm compress is hard boil an egg, let it cool for a minute, put it in a wet washcloth, and then put the egg on. Make sure you let it cool for a minute.
In the shell? In the shell? Do you shell it? Okay.
Yeah, and the reason why I do that, because that just keeps it warm. As you put the compress on, the cloth is cold before you even get it there. So that's just a little trick. But the trick, I got to tell you, let it cool. Do you hear me say let it cool? This is for all the lawyers out there. You must let that cool some. Okay.
Yes.
I'm just saying that because people do something, say, well, Dr. Veronica said, and lawyers and people. So now, what happens if it doesn't go away, and they usually go away quickly with warm compresses, is a lot of times they can go away with sometimes antibiotic steroid drop, because there's a lot of times a little bit of infection about it. And then eyelid washes, we call it lid hygiene, where you use baby shampoo and a little bit of water and wash your eyes.
Okay.
So use the baby shampoo and the warm compresses to clean the area as best you can. Because there's you'd be surprised how much crud is on your eyelid. We look under microscopes every day, so we see the crud on eyelids. So you can't see. Because, that's what we do as ophthalmologists. We look under a microscope all the time. It's your eyes. Now, what else can be done for it? Sometimes you can put a steroid injection in it if it's been there for a while, and that will dissolve it. It can be done right there in the office. It's not that big of a deal. And sometimes they have to actually be cut out. And it's also an office procedure. You just go in, we flip over the eye, we make like a little X cut, we scoop it all out and put you on like an antibiotic steroid, and it's gone. And so it's something that's pretty simple. Most people, though, it does go away in a week or so with the warm compresses and the lid hygiene.
Okay. All right. We've got a couple questions coming through here. Megan is asking, why would a ketogenic cause me to develop dry eyes?
I don't know.
That's very strange.
The only thing that I could say about the ketogenic is it tends to be not balanced.
Okay.
Very well.
Yeah.
And so it could be a micronutrient deficiency that's doing it. Let's think about kind of how you're eating with ketogenic. You're not getting the spectrum of everything possible.
Right. I don't know. I agree with you. Yeah.
I'm not talking junk type food. I'm talking just regular whole food. In the ketogenic, there's whole groups that get cut out.
Yes.
A lot of times people are eating ketogenic, you can't have fruits and things like that. Well, there's a lot of micronutrients in fruits that we need. And so you may be more susceptible. You might have been low in the first place in it. And so that's what happened. So ketogenic, people fight about this. There's not one diet that I think is right for anybody.
Right.
Most of the people that I've seen, and when I go to these medical conferences where they talk about this on a scientific level, most of the experts, even ones that study ketosis in their lab, think it's meant to be done intermittently, as opposed to all of the time.
I agree.
And cycling in and out of it.
I agree with that. Yeah.
So it might be that the person who asked about the keto, going on and off it might be the best thing for them, except that keto is not, I don't think we can find any ancestral people who ate like that all of the time.
Right.
The only people I think can eat like high fat are people like Eskimos.
Yes.
They don't do it 24, they don't do it 365.
No.
They do it at a particular time of the year.
Right.
So that's another thing, just for people to figure out what your right eating style is. Doing a genetic analysis can be extraordinarily helpful in that. We don't necessarily know all what our genetics are, because there's been, so much moving around and marrying and having, you know what I'm saying? So hardly anybody is pure. So figuring out what your genetics guide you toward can tell you what is the best eating strategy, what vitamins and minerals you may be deficient in. So for instance, for me, I need B12. I'm going to die on a vegan diet.
Yeah.
That's just the way it is. That's what my genetics say. I need it. Before I had my genetics tested, one of the practitioners I worked with said, eat more red meat. Now, I wasn't purposely trying not to, because that's what I was doing. But B12, methionine, D, B6, all these things, when I had my genetics tested, show that you will tend, based on your genetic code, to become more deficient in these things. So that means you need to eat more food with these things in, and you may need to supplement these type of things.
Okay.
Vitamin D. I mean, obvious people with darker skin tend to become vitamin D deficient more. And this is all my genetic tests said that particular thing. So I think these are, now, your genetics are not your destiny. I think you should use genetics in conjunction with a metabolic test, like organic acid test, so that you know where you actually are metabolically, to figure out what you need to do, eat, take at that particular time in space. Just because your genetics say that you will tend to be deficient doesn't mean that you are.
Right.
So you have to put things together. You can't just use one test in isolation.
Right. Okay. We're getting close to the hour. We got a lot of questions here. What about pinhole glasses for improving vision?
It's fake science.
Is it?
Okay. So no, it's not. It doesn't. It will not stick. So what pinholes does is it takes one ray of light and focuses on the retina, so images become clear. It doesn't exercise your eyes or anything like that to make them stronger. Okay. So everybody who puts on pinholes, if they have what's called a refractive error, which means you're nearsighted, farsighted, or have astigmatism, will get better when they put on pinholes, but it will not resolve the underlying nearsightedness, farsightedness, or stigmatism, which have to do with the native shape of your eye. If you're nearsighted, your eyes are long. That's myopia. If you're farsighted or hyperopia, your eyes are short. And so everything doesn't go to the back. Astigmatism is the front part of your eye. The cornea is shaped not perfectly the way it's supposed to for light, or you can have what we call lenticular astigmatism, which is in the lens of your eye. So putting a pinhole in front of the shape of your eye is not going to change the shape of your eye. Okay. And that's why it's not going to work. So you will see clearer, but you'll have to wear the pinholes all the time.
Okay, great. So I see all the questions coming. I'm going to scoot down because we just talked about nearsightedness. Dawn is asking, can it be corrected naturally?
You have to see what it's from. If you have a long eye, sometimes people are nearsighted because they have a spasm in their eyes from looking up close a lot. So if you get like a kid that's really, really, really studious, they might be nearsighted because their eyes stay in spasm up close all the time. What we do with that is there's a particular type of refraction we do to take that out, and then we can see what the native eye is like. Mm. This is very technical, complicated in physics, but if you go to any good eye practitioner, I'm partial to ophthalmologists, but eye practitioner, they'll be able to figure out that. But it's not, if your eye is long or short, there's not going to be a natural fix to make your eye longer or shorter.
Okay. All right. So Natalia's asking, it's kind of going back to blepharitis, which is probably just going to be you saying keep your eyes clean. But is there a natural treatment for chronic that comes and goes? So blepharitis
is a skin condition. And it tends to go along with people who have conditions like rosacea, acne rosacea. So one of the best treatments for blepharitis, think about it, it's an underlying inflammatory condition, is to treat your whole body for your inflammation. And then also realize when you have blepharitis and it's a skin condition, you're probably that extra sensitive person. You got thin skin, or that other side. But it's an inflammatory condition, so you need to address your inflammation throughout your whole body. So figuring out what is causing you to be inflamed other than stress, because people who have blepharitis, it'll get worse under stress conditions.
Right.
So treat the underlying root cause of the inflammation. Number one, you already know this, is looking at your foods. So keep a diary, giving it to somebody and saying, okay, what could I be eating that's inflammatory? And if you can't figure it out from a food diary, then you go to food sensitivity testing to see what's going on.
Okay, perfect. Linda says, do you know much about using ozone or ozonated water as an eye wash to oxygenate the optic nerve? I've done this in the past and maybe had some improvement in my optic photos at the doctor.
Are you talking about drinking ozone water?
She said washing.
Washing. Well, the way the eye is made up, it would be very difficult for it to get to the back of the nerve from just doing an eye wash, just the way it's all encapsulated. Is it impossible? I never say anything's impossible because there's micro stuff that we just can't see and measure. Can it work? I don't know the answer to that. I can't tell you that there's evidence that we know one way or the other. So
yeah, maybe it was placebo. Maybe placebo effect kicked in.
And placebo effect is good because the body figured out how to heal itself.
Right, exactly.
So if ozone made your body figure out how to heal, keep doing it.
Right. Okay, Linda also asked, do you feel that the bright eye photography at the eye doctor is a helpful diagnostic tool, and is it safe?
Eye photography can show you all the things that are going on in the back of your eye and your whole eye. It's a great diagnostic tool. It hasn't been shown to cause any problems at all. It's just a very high-powered camera. We have other ones that are computerized. It can give you lots and lots of information about what's going on in your eye, and it's safe completely. I mean, like snapping a picture. I mean, now everybody's talking about EMFs, so I don't know if there's EMFs in the camera or anything like that.
Right.
But as far as it's just you're seeing it, and when you do, if there's flash going on, that flash, your eyes, your rods and cones adjust to that. That's what they do. So it's not dangerous. Okay. So it's a good idea. Let me tell you why it's also a good idea, because it can document where you are now. So let's say you have an eye photography now and something happens in the future, you can go back and look at that previous picture and do a comparison.
Yeah, so, it's like a baseline sort of.
That's right.
Yeah. Okay, last question, and I don't know if anybody else's, but this is my question. What in the world makes your eye twitch and not stop? What in the world? Do you know what I'm talking? You know what I'm talking about?
Okay. If I could answer that question from an anatomy and physiology point and figure out what to do about it, I would not be here talking to you. I'd be kicking back in Bali.
Okay, so right. I mean, I had a friend tell me the other day at the gym. She said, "This is not stopped for 20 straight minutes. What's happening?" I'm like,
but let me just tell you some other things you need. It's a muscle spasm.
Right.
So whenever you're having a muscle spasm, you got to think about micronutrients.
Magnesium.
Think about your minerals. Think about your magnesium, your selenium, your zinc. And so you want to check those type of things. But I don't know. We'd have to check that. That's not standard, but it is a muscle spasm. And they have people who have it and it stays forever. And that's where we started using Botox. Botox was used to treat that condition. It's called benign essential blepharoplasm.
Okay.
Blepharospasm. Botox was used before it was used to make people cute. People are cute with wrinkles too, but
yeah.
But before it was used for cosmetic purposes, we would get Botox to treat that particular condition.
That's crazy. Okay, actually, this is the last question. I'm hoping I'm asking it right, but Linda says, can you address your treatment for drusen? What's drusen?
Oh, drusen. Age-related macular degeneration is drusen.
Okay.
Age-related macular degeneration.
I got to leave it to her to use a medical term and not just say age-related macular. Linda's like a brainiac.
Drusen are these little hard spots in the eye. All right, I'm going to say something. This is not standard,
Prescriptive.
everyday stuff. I'm going to write an eye book.
Okay.
Fix your leaky gut.
Fix your leaky eye. Fix your leaky eye.
Fix your leaky eye. It's your eyes leaking, and that's what's going on when you have drusen. Some people, it tends to run in families. It tends to be in more light-eyed people, but you have a susceptibility there that your membranes aren't tight enough. And so anything that would tighten your membranes in your eyes, and to me, everything starts in the gut and digestive system.
Of course, yeah.
This is not, I'm telling you stuff that's not standard. It's not protocol. It's because I'm an eye doctor and I've thought about all these different conditions from a holistic standpoint and what they represent in the rest of the body. The eye is an outpouching of the brain and gives you a signal of what's going on in the rest of the body. So if somebody has high blood pressure or diabetes or any of those other, a myriad of conditions, thyroid problems, we can see all that stuff in the eye. This is how eye doctors are so brilliant at diagnosing all kinds of diseases. Yeah. When we study the eye, not only do we need to know what happens in the eye, we need to know everything about what happens in the rest of the body.
Right. So, I mean, it's all connected. Nothing is separated from anything. Yes. So interestingly enough, and then we'll wrap up, I'm just going to throw this out there. My dad has had 3 corneal transplants, and 2 of them have failed due to Fuchs disease. So the cadavers that he got his corneas from, 2 of them had Fuchs. He had Fuchs prior, and yes, and so the people that he got his corneas from were in their 20s, and apparently the Fuchs had not shown up until the age of the eye. The eye had aged significantly, and then Fuchs showed up like in the age of 30 of the people who gave him his eyes or something like that.
Wow.
Isn't that crazy?
Yeah, it's interesting.
So he's had 3 corneal transplants, literally.
How old is he now?
74, I think. 74.
Wow, that's interesting.
It is, but it's genetic, right? So Fuchs is genetic.
It runs in families, yes.
Yeah. So,
but you don't know necessarily that you're going to get it.
Right. Right. So, can you test for that, or how do you test for that?
The only way is by looking for the early signs of it, and you never know how quickly something is going to progress or not progress. I got to say that every single disease that I've ever seen, and you probably can verify this too, that when you do your life as healthy as you possibly can, they don't tend to manifest.
Right, of course.
Severe or may not at all.
Right.
It's like you see people, they have BRCA genes and they don't get breast cancer.
Right.
When you fix everything else, not just from a physical level, but from a spiritual and emotional level, a lot of times something that everybody else in your family might have, even though you have the genes for it, they won't click on and you will not have it.
Right, exactly.
So if you go into the doctor and they see it, you just say, okay, what do I need to fix that I'm not seeing? Well, let me look around for that. You know what I'm saying? Yeah, think of this, all the eye analogies. And now, can I guarantee that it's not going to manifest based on living the healthiest lifestyle possible? No, because there may be another spiritual and emotional lesson that you need that makes you get Fuchs disease. It's not all worked out. That's why you can't tell who gets what, because everybody's on a particular journty, but they're messages.
Yeah, so. I agree. So you guys, I just want to give you a heads up that I'm popping in one more time, putting a link into the chat that'll take you to a free gift from Dr. Veronica. So go ahead and grab that link right now. Regina, I see your question here, but I'm going to go ahead and I'm going to take that chat question. I'm going to bring it into the mentorship group and answer that live later on, because that's kind of an extensive question and we're already past the hour. But so grab the link, you guys, and go out and I'll share it in the replay as well. And it looks like we have more questions coming in again here.
I like to see questions here. I'll be like,
all right. We need
to do more. What we need to do is, maybe Carmen set something up.
Yeah.
And do something a month or 6 weeks from now where people post wherever they're posting, and you get a collection of questions and we can answer. Because people are asking me, eye questions and body questions. And I love it because I have deep knowledge and some different knowledge that, I might be the only functional medicine specialized ophthalmologist out there. And so I'm thinking about these things that I've seen in my practice all the time, but also with the intuitive stuff. Here's the thing. Somebody's asking about, what do I do with my body? I'm getting sick from a relationship while I'm still staying in a relationship.
Yeah, that's Regina. That's the one I was going to kind of address later on. Because I only have 5 minutes before I have to be on a conference call.
Yeah.
So we have to wrap up.
Carmen's got to answer that, but we can do something another time. I'm happy to do that, answer questions.
Here's what I'm going to do. When we send the replay out, I'm going to put in a note in there that if they have specific questions for you, we can gather a list of those things, and then we'll bring you back, and we will have that predetermined list, but we'll put it in the replay, and I'll post it out into my groups, and we'll just start gathering questions, and we'll do it again.
Absolutely. I don't have any problem doing that.
You're awesome.
I appreciate that you had me. It was so much fun.
You are amazing.
I got to tell you, the gift that I give to people is a meditation that I made a while ago. And I found out one of the guys on my team, like a couple years later, he's like, oh, I listen to your meditation all the time. I didn't realize it was I was like, I need to start giving this out to people. So it's a meditation on flowers. And it's audio and visual. If you want to watch something, you can do that, but it's audio. It has music. I'm walking you through a visualization to help your body relax and distress. The biggest problem people are having now is not being able to lower their stress level. So I've also, because of my voice and the tones in it, people have told me I understand I have some healing tones in my voice. And so it's a gift to anybody who wants to use it, listen to it, help you relax. And that's why I give it, because I realize that if you go to your practitioner and you're stressed, we're not going to be able to fix it with some diet and vitamins.
That's right. Listen to it before you go to your practitioner, and then again when you get home, right?
Maybe you can listen to it while you're in the practitioner's office, because sometimes they're saying stressful things to you.
Put it on your phone. All right. Thank you so much, Dr. Veronica. I appreciate you. Truly appreciate you. And thanks everyone for the great questions. And as always, we'll bring you back. People want you back. We'll bring you back. And
thank you so much, Carmen. I appreciate it. And thanks everybody that came to listen. I love you all. No matter what you follow, I love you.
Have a great day. Talk to everybody later. Bye-bye.